Thank you and welcome. I'm going to share with you the following topic: health licensure and accreditation. In the next slide, we are going to see the outlines that we are going to discuss in this presentation. The first one is the definition of licensure and accreditation, the purpose and benefit of health license, the purpose and the benefit of health accreditation, the major differences between licensure and accreditation in healthcare, key national initiatives targeted at improving healthcare, and finally we will conclude. So let's start from the definition of licensure. Licensure is the process by which a government authority guarantees or gives a permission to an individual practitioner or an health organization to operate or to engage in an occupation or a profession. So while on the other hand, accreditation is the formal process by which a recognized body recognizes the health care organizations meets the applicable predetermined and published standard. This is where you find that there is a body which assesses and recognizes that there are some standards of which are set if the organizations meets the standard or the health facility meets the required standard. So the 12 processes are aimed at improving the quality of health care. So moving to the next, we are going to see the purpose and benefit of license. So in the first place, examination of an individual credentials. This is aimed at determining the education and the experience if it meets the legal requirement. This is with the aim of creating safety among the consumer or consumer protection. Inspection of educational program. This is to determine whether those programs they meet the required standard. Administration of exam and test of professional qualifications. Like when they need to know that you are area of specialization or you are able to account for your professionalism, then they give you exam. When you pass, they will actually determine if you are qualified in that field. So granting of races on the other basis of predetermined reciprocity to an applicant and of other adjudications. Another important thing is about instance of regulation establishing professional standard practice. So this is aimed at looking at the best practices or standard of practices, like in different areas. Does the health facility, does the health organization meets the required standard before it's given a license? Investigation of charges or of violation of standards. Sometimes this body or it works to charge people who violate the said standard or they don't meet the required standards. Let's look at the purpose of accreditation. Accreditation is aimed at improving the quality of healthcare, stimulate and improve integration among management of health facilities. This is what we see. Establish comparative database of healthcare organizations. They are able to look at different healthcare organizations and try to compare and see which one is meeting the best practice or the required standard. Reduce health costs by focusing on increased efficient and effectiveness of services. This is the aim is targeting at minimizing the errors occurring in different health organizations or health facilities and so on. Provide education, consultation to healthcare managers, organizations and professionals. This is a strategy to see whether they meet the required standard or what we call the best practices practices. Strengthen the public confidence in quality of health care. This is strengthening public confidence when an organization is accredited, meaning it has been evaluated. And they have seen that this actually organization meets the best or is practicing the best practices. So that builds public confidence to that organization and also in service delivery. Reduces risk associated with injury and infection for patients and also staff. As we said that this was aimed at meeting all the required standards, whereby it now reduces the risk, whereas patients are safe from infections. Also, it reduces risk for the staff members or the working staff in an organization, in an healthcare organization. So moving to another, we are going to see now what are the benefits. Benefit number one is health, promote health, safety, and welfare. So you see, like when an organization is accredited, it enables to promote health, safety and welfare of the people who are using that facility. It serves also as a consumer protection, because as we are looking, if they are able to accredit an organization, means they are able to they have looked to various factors that may be about leadership, about diagnostic treatment processes, and they are come up with a report that this organization meets the required standard. So it is protecting the consumers or the people who are depending on that organization. Provides essential skills that are required in health, like when they are evaluating and looking into details on the organizations, healthcare organizations, they are maximizing the skills that are required in improving those healthcare organizations. Promote professional mobility and enhances employment opportunity. This is mainly for the graduates, as one is able to move from one place to another, the opportunities are increased. Determination of eligibility of federal funds program and student aid. So accreditations is also used to measure the eligibility of federal funds. These are funds which are given to help organizations to improve their standards. It enhances national reputation and also recognition. This means that when something is accredited, it gains a reputation from different stakeholders, from different people, and also for a professional person in that area, you gain recognition. You are known of your services that you have. It also helps to promote standard practices. And lastly, it's an indicator to funding partners. It means that those people, like private and government stakeholders, those who help in funding those organizations, they help their confidence when the organization is accredited, meaning it's offering its service at highest level. So the major difference between licensing and accreditation. So we say license exist primarily for public safety and well-being of consumers. On the other hand, accreditation is the both process and credential. Typically, licensing is involuntary. This one, you are not forced. You don't have options. You have to get a license for you to run your activity or your organizations. But accreditations is a process is voluntary, meaning you can hire a private organization to monitor or to evaluate your organization on terms if it meets the required standard. Individual facilities, program, or organization can be licensed. Here we are seeing that various facilities, programs, organizations can be given a license so that they can operate their activities. But on accreditation is only organizations, agents, or programs can be accredited. So as we are seeing there on the diagram, this is we are seeing accreditations and licensing and certificate. We are trying to figure out the differences that are there. You see, one is voluntarily, licensing is in voluntarily, and also certification is voluntarily. Because I didn't talk much about certification, let me take a second and talk on it. So certification confirms that an individual or an organization meets a minimum set of predetermined and standard criteria to function. Certification may be an individual or entity to provide the services. This is what I didn't talk much about. So moving on, let's now come to the Joint Commission. The Joint Commission has the mission of improving healthcare for public. This is achieved through collaboration with other stakeholders. Their work is to evaluate the healthcare system organization and inspiring them to excel. This is by providing safe and effective care of highest value and care. This was founded in 1951, and it evaluates and accredits health facilitations. They have said that they also accredit like 20,500 healthy organizations in the United States. What are their roles? The role number one is setting the quality standard. They evaluate the organization performance, how it's running its activity, advancing safety, and also the quality. The safety is all about consumer and also the staff of the organization. Transforming the healthy organization. They say they transform the health organization. Also, they have accredited services. As we said that they give the accredited services, they come and they evaluate if your organizations meets the standards or the best practices, then they accredit you, and then you are going to gain a good reputation. Moving on, National Committee for Quality Assurance. This also has a mission of improving the quality of healthcare. It helps serving people stay healthy and save countries money from wastage. Also, this has also some accomplishment, because they also do healthcare plan accreditation. They look at the different organizations, their health plans, and they accredit them. They have also what we call patient-centered medical home recognition and the quality solution globe. This is some of the achievements they have made so far. Let's look to their roles. Role number one, they highlight top performers and drive improvement. They look at different organizations, healthcare organizations. They look at those ones which are performing very well. From there is when they inspire others to drive into improvement. Measure the quality of medical and practices. They also measure the quality of medical the consumer are given, and their practices, are they meeting the required standard? Helping in measuring and improving quality of both government and private clients. They say this committee, they are also hired to measure the quality for both private and clients. So you can hire them, they come and they measure and they make recommendation on how to improve the quality of both private and government clients. So let's look also US Department of Health and Human Services Agency for Health Care Research and Quality. This is a federal agency agents charged with improving safety of the American healthcare system. In US, they say healthcare system prevented like 1.3 million errors. This means they saved 50,000 lives and avoided the wastage of 12 billion US dollars. Let's see the roles they play. It develops tools and the data needed to improve healthcare system. They also invest in research of national health delivery system. These agents also create materials to teach and train healthcare systems and also professions. They offer education, generate measures and data usage by providers and policymakers. They generate measure and the data used by providers and policymakers before making policies, and they have the data that you should compare and contrast before you make those policies. Another thing I'm going to talk about is Centers for Medical and Medicaid Services Quality Initiative. CMS is a group of professionals from different backgrounds. This can be from clinical, scientific, public health, legal, IT, information technology, project management, academic, business management field. The initiative aim is to improve the quality of healthcare system through accountability and disclosure. It requests information in transforming clinic practices. So it has a quality strategy which involves fiscal quality report program strategy vision, physician quality reporting program strategy vision, and quality improvement organization. It's also developing of quality indicators for inpatient rehabilitation facilities. It also do what we call quality measure. It measures the qualities of different healthcare organizations. Also, it has post-acute reform plan. This is what all they do. Moving on to R is Human. Institute of Medicine. Medical errors can be defined as failure of planned action to be completed as intended, or some can say the use of wrong plan to achieve an aim. This also Institute of Medicine has some roles or what they are doing in order to improve the life, to ensure that the healthcare quality is improved. The first aim is it aims in reduction of errors such as diagnostic, treatment, and preventive, among other errors that occur during those processes. Establish national focus to create leadership research, the tools, protocols, and enhance knowledge about safety. So they establish a national focus to create leadership, which in its purpose is to enhance knowledge about safety, identify and learning from errors by developing nationwide mandatory reporting system. They also identify and learn from errors, the errors that are made before. As I've said, that they are different. We have diagnostic, treatment, preventive errors, among other errors. They raise also the performance standard and expectation for improvement of safety. They also raise this performance. Implementing safety system in healthcare. So if there are safety system which have been maybe given or they have been recommended, they help in implementing them so that they can minimize the error. Moving to another one is closing the quality charms. This is also under the Institute of Medicine. So a new health system for 21st century report on the healthcare in the United States. This is about the new report that was done in 21st century. And they say this was the second and the final report by Institute of Committee of Healthcare Quality in America. The quality chasm report describes broader issues and defines 6 aims. The role of the role of closing the quality chasm is redesigning care delivery, reforming the health professions, that they reform so that can meet the required standard, quality of care of Americans in the rural areas. They also aim to reach out to those Americans who are living in the rural areas. They encourage information technology implementation, the use of technology in implementing information, provide prevention of medical errors. I've said medical errors that we have said previously about those medical errors like diagnostic error, treatment errors, among others. They also pathways to quality health care. So there is also nursing home quality initiative. This is a website that provides consumer with information regarding the quality healthcare of nursing homes. This is where you can go, you put the details that are required, and then you get information about different nursing homes. Nursing homes is to compare contained in details of every medical and Medicaid of a country. They say that these are information that are given in the website that try to compare from one different nursing home to another, and when you want to see the kind of services that you need, you just have to look on those websites to see if they can provide the services that one needs. Their role is this instead of contain current information, useful information for consumer and family in selecting nursing homes, as I've said before, assures quality health care for all Americans through accountability and public disclosure, meaning that if the nursing homes they are able to display their information online, so one is able to look at different services they are offered, and in case of anything, the nursing home can be held accountable because the information is published online, and it can serve as an evidence in case of anything. So it promotes accountability. So as you see, this is one of a standard word for a patient. As you can see, it has different parts. As you can see, these are some machines. They have nice beds here. They are adjustable. They have different, even the hygiene is improved. So all these places showing different how a standard word should look like. Okay, so in conclusion, licensing, accreditation, and certification are significant when one wants to improve the healthcare. Improving healthcare system involve different stakeholders. As we have seen from the above, there are different initiatives, there are different agencies that are working in hand to ensure that everything is done. Different initiatives have contributed a lot in improving healthcare. This has been already discussed. Fixing the errors with the health can save the life and also the wastage of resources, as we have seen from the previously about maximizing errors and also working hard to save the lives of the people. These are the references where the information is derived from. if you can have time, you can go through.